What's up, guys? All right, look, today I want to talk about a medication that is used for the treatment of pain, but that I think can be very useful for tapering off of Suboxone, especially if you've tapered down to very low doses, like let's say 1 milligram or even half of milligram, and maybe you've tried stopping at those lower doses. Maybe you tried, pushing out your timeline, which I often recommend. Instead of taking it every 24 hours, try every 25 hours, and then after a week, every 26 hours, after a week, every 27 hours, etc. Maybe you tried those methods and they just didn't work for you. Maybe you had severe post-acute withdrawal or fatigue or whatever it is. You just never could stop, okay? So let's talk about this medicine, Butrans, which is basically Suboxone or buprenorphine in patch form, okay? Now, it's like I've mentioned this medicine in other videos. I'm almost positive. If I didn't, I'm sorry. But it seems like lately I've had a lot of questions about it. And I was actually planning to do this video, and I got a question today from somebody about it. I thought, well, it was meant to be. I need to make this video. And I want you guys to go check out the channel Kickin Addiction. And Kevin just posted a video as well, and he talks about the patch. So what is this patch? So basically it's a patch that is used for pain. The brand name is Butrans, but it's buprenorphine. It's in a topical form. You put the patch on, you change it weekly, okay? It comes in differing doses, all right? And these doses are going to be strange, and I'm going to talk a little bit about the pharmacology. But I want you to understand that dosing, when we talk about a dose, we're talking about a vector getting it into the body to be used, right? So the actual milligrams, though important, what's really important is what the body is doing with that, okay? So it gets kind of tricky in even if you have the same medicine, if they're in different forms, those medications may not be used by the body the same way, so the dosing might be different, right? So, but from my research of the pharmacology of these two, comparing buprenorphine sublingual and the Butrans patch, if you're at like a steady state in the body, kind of all factors being equal, then the Butrans at the 20 microgram patch is going to be kind of equivalent to I believe a little bit less than 1 milligram. So maybe like a 0.75 milligrams, somewhere around there. So if that's the case, and then again, just because the pharmacology works out that way doesn't mean like everybody's going to feel it the same way. But if you taper down to 1 milligram and then you started the patch at 20 micrograms, you're going to change that patch weekly. Now, more than likely, you could get a prescription for a 20, and then after a week, maybe get a prescription for the 10, and then the 5. But I would probably just stay on the 20 for a month. So change it weekly, and then I would go down to the 10, change it weekly, then down to the 5, change weekly. And then that last week on the 5, I'd probably just have my patient keep it on for as long as they can, and we'll discuss some of this, and just let it taper out. Okay. So, caveats. Well, this is off-label treatment, guys. I'm not giving you medical advice because this might not be the right choice for you. You need to talk to your doctor. You need to examine, you and your doctor examine all your options, the risks, the benefits, etc. I want you to stay clean and safe. Okay. Got that out of the way. So, don't take advice from the internet. Talk to your doctor. That is number one. Okay, so this medicine is, again, it's approved for pain. Any doctor could technically write this, but if you're taking it to taper off of opiates, you really need to be seeing an addiction doctor. So even though they don't have to have a waiver or an X number, or what we call it, to write this medicine, that's who's going to prescribe it for you, because other doctors are probably not going to understand exactly, they're not going to necessarily understand what you're trying to do. Does that make sense? Or the best way to go about it. And not their fault, but it's just that's not what they're trained in, So, but I think that system would be a useful system to taper. Now, why have we not been doing this often in the past? Well, one is it becomes problematic for a couple different reasons. It's off-label, okay, and it's tricky when writing controlled substances for other uses than what they're approved for. But obviously, it's buprenorphine, so it's the same thing as buprenorphine. So what does it matter? Exactly. So I think it can be used and be used safely. Now, in the past, though, the brand name was very expensive, and this kind of kept some patients from trying it, especially like if you've tapered down to low dose tablets, you're just buying a few or whatever. You've already like cut your costs so much from probably when you started treatment. It's hard for people to then go back and start spending more. And so that was a big prohibitive factor in the past. But now there's a generic. I think the cost seems to be coming down. There might be more availability now with your insurance plan, but again, you're probably going to need a prior approval, and the approval is going to be if you have pain and you've probably failed these other pain and so if you're not taking it for pain, then that's going to be difficult getting the insurance to cover it. Okay. So what are some other problems with having a patch as a medication? Well, this patch is supposed to stay on for a week, and sometimes the adhesive just doesn't work that well. Now, there's other options you can do to try to keep it on, okay, and talk to your doctor about those options if you're having trouble. The other thing with patch medications is you have to be careful with extreme temperatures, particularly heat. So if you got in a bathtub or a hot tub, you shouldn't do that with a patch. And if you're in the shower, you need to be careful letting the hot water just pound on it, because that can change the way the medication is released, and it not be consistent and could have problems. You have to be careful with disposing of the medication so that when you change it weekly, because there still may be some active medication there, so you have to be careful and dispose of it in a safe manner. So that's kind of the general idea behind using this medication to taper off the buprenorphine. So if you can taper down, you get down to 1 milligram, and then maybe you can change over to the 20 microgram patch, and then maybe you can go down to the 10, then maybe to the 5, and then hopefully that will be a very smooth transition then to stop buprenorphine altogether. So I'm going to also do a video pretty soon on Sublocade, because I've had a lot of questions about that, and the subcutaneous injection, and we're going to talk about utilizing that to taper, and then maybe also give you some idea of how it's equivalent to the other doses of buprenorphine, because it might be more effective for somebody who's on a higher dose having a hard time tapering, like an 8 milligram or something. Excuse me, or somebody who's about to go into some type of facility where they're not going to have any more medication. There's just some different options where that might be very ideal for people. Now, I think I covered everything I wanted to say. Go check out Kickin Addiction's channel. Leave some comments, questions. If you've had experience with this, give me some feedback. Let me know. But by all means, talk to your doctor. Do not take advice from the internet. Guys, and remember, these medications, they're tools. They're tools for your recovery. The real recovery is what you do with your life. You should be pointing your life in a direction of purpose and meaning. Okay? So, peace. God bless. Talk to y'all later.